Greetings. This is Mushtaq Memon, Professor Emeritus from Washington State University. Today's video is about understanding of canine whelping and dystocia. First of all, I may remind you that the average duration of pregnancy in the dog is 62 days, but that's just an average. It could range, from somewhere from 59 to let's say 65, 67 days. So I think depends upon history and so many other things. But for your, memory, I just keep 62 days on average. Now, this is a multi-parous animal, means delivers quite a few offsprings, pups. So everything takes quite a long time for different stages of whelping. So first stage is the cervix dilates, which takes quite a few hours, as mentioned here, 6 to 12 hours, which follows by expulsion of the fetuses or puppies, which may also take 3 to 6 hours. And after that is the expulsion of placenta, which is also, a long process, but at the same time, when pup comes out, followed by the placenta. So when a placenta comes out, you may notice there dark greenish discharge comes out called lochia, as some people call lochia. So what they discharge is just coming from the placenta. So when placenta is separated from the uterus, that lochia comes out. So if you see the lochia before fetus comes out, that's not a good news because there is a disconnect between placenta and the uterus, so that fetus may be at risk due to limited to no oxygen. So in those cases, I think we look at very carefully, do the ultrasound if needed to be, find other ways like C-section, things like that. Now to understand this whelping process, there are so many hormones involved. And just for this video, I mentioned only this one slide here, which shows, as you can see on your left and vertical axis, we have progesterone or prostaglandin F metabolite. And on the vertical axis are the days from parturition. So what it means is that the corpus luteum, or in this case of which we have corpus lutea, many corpus luteums, they produce progesterone, and that is a hormone which keeps the pregnancy safe, and it's almost like a security gate. So that progesterone has to come down before animal can deliver. At the same time, the prostaglandin metabolite, F especially, goes up. So with that nice balance, then we have the delivery. So I don't want to go into too many details of the roles of relaxin and oxytocin, and so many other hormones obviously involved here. But for our discussion today, I just want to make sure that we understand that because in the bitch, when progesterone goes down, it causes hypothermia. The body temperature of the bitch goes down, and then it goes down, as you know, about the normal temperature, close to about 37 degrees centigrade. So it goes below than that. And that may be, somewhere from 18 to 24 hours before whelping. Now, what is dystocia, or some people call dystocia? All it is the difficult birth. Now, why there's a difficult birth? Why is there a dystocia? Well, there are many causes. The first one, as I mentioned here, it could be the size of birth canal. That the bitch is smaller and her birth canal is smaller relative to the puppies which are going to come out. Or it could be the fetus may be oversized so that, the pelvis cannot accommodate that. Or the other very common reason is the inertia, means no activity. So as you know, when whelping takes place, then uterine contractions are there. And for some reason, if there is hypocalcemia or some other reasons that the female does not go in a contraction of the uterus. In that case, would be what we would call primary uterine inertia. I mean, this bitch did not even start getting into contraction of the uterus. Or the bitch has been trying and trying to expel these puppies, and she got really tired. The uterus got tired. This is what you call secondary uterine inertia. Now, the typical history of the dystocia, difficult birth, is that it just did not go in labor or delivery on the due date. And that's pretty tricky. What's the due date? Well, as I mentioned earlier, the pregnancy duration is 62 days, and the range is quite a bit. So people may get very anxious if it's 62 days and the bitch is not delivering. As I mentioned, depending upon the breeding, yeah, if you have done some other assays during the breeding time or artificial insemination, like progesterone and LH assay, you may be a little more accurate than just trying to go from the breeding time. And then, bitch goes through earlier contractions. Looks like, she is having this cervical dilation, but she's not able to push the fetuses out. So that's the other reason. Or there is, 4 to 5 hours or more than that, the first puppy has not come out, or there's more than 2 hours between puppy deliveries. So it's really quite a bit of variation. So we have to keep in mind and make our clients understand also that they have to have patience because it takes so much time. How can you diagnose that? Well, number one is a physical examination. And we look at the reproductive tract. You can try to feel the abdomen. And at that stage, when fetuses are fully formed, you should be able to feel them through abdominal palpation. Have to be gentle, but you could do that. Or if there is a suspicion that fetus may be stuck in the vagina, you may clean your hands and put your glove and lubricated finger and just stick in the vulvar area and the vagina and see if you are able to feel a leg or a head of the puppy, so you know that maybe it's stuck right there. The confirmed diagnostic tests are really two. One is the radiograph or X-ray, and what that does is the radiograph is in fact the best way to count puppies. But the count of puppies does not really tell you if they are live or not. And that could be done through ultrasonography or ultrasound, where you are able to pick up a beating heart of those puppies, which is the ultimate of the, fetal health. And sometime if there's a compromise in the heartbeat, you could also pick up that one too with ultrasound. And then also serum calcium. Is it that there may be hypocalcemia in this bitch that has not really encouraged that contractions and the bitch comes, in active phase of whelping? So if that's the case, then we may think about supplementing some calcium intravenous for that female to go ahead and complete the whelping. Now, how we are going to treat that? Well, there are quite a few pictures in different books and papers shows very nicely about the forceps and things like that. I am really very reluctant to apply any forceps or try to pull hard on the leg or the head of the puppy because they are very fragile. It doesn't take much force to dislocate, leg or some other part of the body. So I try to be very, very careful in fact not to pull anything if the puppy is live. Now, if it's a dead puppy and you are confirmed with different ways that puppy is not suckling or is not live, then maybe you could do some manipulation. So for that, I have just one example. But before I mention about manipulation, I like to let you appreciate how the pelvis look like. From the top, you can see that's a pelvic girdle, and you can see on the horizontal axis, it's smaller than the vertical axis on the pelvis. So the pup comes out just like any other, offspring. They come out with the horizontal axis that you can see here, going from my perspective, east to west. So if you have got a pup which is very large, those shoulders may be stuck right there. So the idea is, which we use fairly commonly in many larger animals, especially cattle, to try to turn the fetus on the vertical axis. As you can see, vertical axis is much longer, so we have more space there that we could do that. So I would presented this one case, and I happened to be, this was an emergency call in Washington State. So as you can see, on the starting from the top on the left is the female, which had been trying to whelp, but she couldn't. And then once I found out, through my vaginal examination, there was one pup there. I tried to stick my finger in pup's mouth, but there was no activity or suckling there. So I really was sure that pup is dead. So I tried to use the technique which I just mentioned a minute ago. As you can see in the middle of that top, I'm trying to hold on to this pup and then try to rotate that. As you can see on the extreme right hand side, the third picture on the top, that animal is rotated. I happen to have students with me, and when the student had a camera, so I requested them to please go ahead and take some pictures. So I was very happy and lucky about that, so that I can share with you this experience. So after that, as you can see, pup comes out at the bottom of that picture. Now here, I'd like you to look at that dark greenish discharge, which shows there on top of the, vulvar area there. It is even, it will be much more obvious if the color of the dog was not black. So you could see it's a fairly dark discharge. So with that, I like to recommend this textbook, which is ultimate for canine and feline reproduction by Dr. Johnston and her two colleagues. It was published back in 2001, but don't worry, the information doesn't change too much. So if you have access to that book, especially those of you who are practicing veterinary, small animal practice and dealing with reproduction, I would highly recommend to have that book on the shelf. So with that, I would invite you to send me your comments and questions about the information I just shared with you. Until then, I wish you well. Bye-bye.